Okay, continue. Okay, now we'll talk about acute laryngitis. Again, ITIS is inflammation, and this time it is the larynx that being inflamed. So there's inflammation in the larynx, and this could be again as a result of infection or a tumor or chemical irritation, aspiration. There's several etiologies, but as you see, there's a very important anatomic um, difference about the larynx. Now this is the larynx, and what is around it is the vocal cord. So this is significant. Now this is the inflamed larynx, and as a result, there's inflamed vocal cords. So because of this, any problem that involves the larynx, whether it's an inflammation or tumor or surgery, you remember that the larynx is actually means the voice box. So the voice of the patient will be one of the classical symptoms. Change in the voice, losing the voice, will be always a sign of any disease or condition that affects the larynx. So okay, always when you think of etiology, it's good to know because it helps you identify who's at risk. Now, when you know that one of the most common cases of laryngitis that doesn't require a treatment, but it's commonly caused by an overuse or misuse of the voice, and it's usually self-limited, no need for any antibiotics, of course. But if it's infectious, which usually viruses, then maybe we need to treat with medication. Now, so if you have a patient just with acute laryngitis, usually they don't have any other symptoms other than partially losing or completely losing their voice, and maybe some irritation or some pain around the larynx area. Other than that, they don't report any other symptoms. But if it's infectious, now that's if it's because of overuse of the voice. Now, if it's infectious, they may report symptoms like fever and cough and rhinitis, which are symptoms of upper respiratory. Now, so that's what they report in their history and physical examination. Basically, you will hear clearly the classical symptoms is the hoarseness or the hoarse voice, and some patient may even have dysphonia or aphonia. Their voice is completely lost. Depends on the etiology, we will consider the management. If the patient has a chronic laryngitis, or if it's severe enough that's affecting the airway, and it's beyond just an infectious laryngitis, then a nasolaryngoscopy could help to identify the problem, and in some cases it's a tumor. It could be a larynx cancer. So that's why this procedure will help us identify the underlying cause of the problem, and again that would be a chronic laryngitis if there is something like tumor or cancer. Now, unless it's infective, the management is there's really no medication requires. It's a matter of time until it's self-limited and inflammation subsided, and then the voice comes back normally. Meanwhile, while the patient is waiting for the problem to resolve, we encourage them to avoid activities that can make it worse, like give your voice a break. Stay away from anything that can irritate, like smoking and allergies and so on. And a humidified air would help, especially if there's irritation. So again, educate, rest your voice, stay away from irritation and allergens, and just a matter of time. Sometimes take a week, sometimes less, more, but that will be the only symptoms that the patient will report in case of acute laryngitis.